Welcome to the Rehab Links Secrets to Success podcast. I'm Lisa Chase, your host. And today I'd love to welcome, we call him Dr. Mike DeBord from B3 Sciences. Welcome.
Thank you. Great to be here, Dr. Lisa.
So great to have you. I was, your background is in chiropractic, and you were a chiropractor for many years, and then you became introduced to blood flow restriction and started B3 Sciences. So I'm really excited to kind of hear about your journey and, how you, kind of went from, chiropractic clinical practice to now really being one of the leading experts in blood flow restriction, and how much it's really changed, your life. I know personally you've used the B3 bands to help you recover from a hip replacement surgery, and many people that you've worked with, both, within, I'm sure, your practice, and then other practitioners like myself who you've, helped to really implement it into our clinic. So why don't we just kick it off, and you tell us a little bit about your background and your journey, and we'll kind of go from there.
Yeah, well, thanks for having me on your awesome podcast. Yeah, I was a sports chiropractor for 16 years, had a high volume practice, treating anywhere from 40 to 60 patients a day. And one of the things that happened to me is I had a lot of traumatic injuries, joint problems. So I got worn out from an arthritis standpoint practicing, and pretty much had to look for something else and phase myself out. And I got into the health and fitness industry. At that time, I had gotten into organic superfood type products, and helped build up a couple companies. The last one did very well around the world. But in approximately 2014, Dr. Jim Stray-Gunderson, who was one of our pioneers here in the United States, he's one of our top Olympic training docs. He had discovered BFR in Japan. They'd been doing it for a long time. Everything from kids to seniors to light exercise to elite level athletes. And he was fortunate enough to meet the godfather of this technology in Japan. He brought it over to the United States. When they brought over some of those BFR devices, and we'll talk about what I've got on my arms here, I bought one of the first ones, and it was a very interesting experience. Imagine doing something light like going for a walk or lifting some water bottles or doing some air squats, things we do every day, but it feels like you're in the gym working out, doing 10 times the amount of work. And it was a fascinating experience. I got that pump and that burn in my muscles without having to do anything heavy and without feeling any pain. And right away, my joints started feeling better. I mean, in the very first session. So fast forward, I started using this technology from Japan, and it was very expensive, the Japan blood flow restriction device that I was using. But in 60 days, I felt 20 years younger. I put all my muscle back on. I got my six pack, and Dr. Lisa, you just saw a real quick transformation in 3 weeks. So, and that prompted me to work with Dr. Jim. He was working a lot on the medical Olympic side, coaches side. It prompted me to launch a company to take it out to the general population. Because think about it, everybody needs exercise in the rehab environment, in the home exercise, just general exercise, but everybody's got the same challenge. Time, it's too hard, it hurts, I pulled something, it's expensive, I don't get results. So through that journey in October of 2019, I was able to launch B3 Sciences. I was running another very big company. I actually walked away from that. People thought I was crazy, but I kind of saw where the potential was for this. And here we are 4 years later, and we've got, close to 35,000 people using blood flow restriction or BFR bands. And the stories have been absolutely amazing. And we're talking everybody from 6-year-olds to people who have injuries, to people who don't like to exercise, to people who are serious exercisers, up to 80 and 90-year-olds. A new technology that's just completely changing the whole landscape of how we approach exercise. And, you know, here we are 4 years later, and we've got all kinds of celebrities and pro teams and physical therapy centers across the country. So led me to this awesome podcast where we can share more with you and your audience.
Yeah, well, I had known about it for years from my colleagues, and then I had another physical therapist who we should give her a shout out, Lori Diamos. She's the one who introduced it to me. And, your bands are just, they're so easy, like the way you have, created a whole system, how you've packaged it, making it just so simple for anybody to do it. That's one of the things that I love about it, not only for myself, but for my clients. So let's just might be going blood flow restriction. Like, what is that? Like, they might not know. So let's just dive in a little bit to give a background about, well, what is it, that we're doing with blood flow restriction training, and how is it really benefiting our bodies and our health, our pain? Let's talk a little bit about that.
Okay. Well, the first thing is, this is what's called a blood flow restriction band. Now, you might think blood pressure cuff. A blood pressure cuff is wide and it's rigid. And a blood pressure cuff is going to squeeze your entire arm with the goal of pushing deep into the tissues and cutting off the arterial flow so that you can measure what that pressure is. This is a completely different concept. This is a flexible band, and it has multiple air chambers. Now, this is a patent. This is unique to us. Now, what does it do? So look how easy this is. I simply slide it up my arm. Okay. I snug it down with the Velcro. Comes with a pump, little manual pump. I just took it on right here. And there's a number on the band on this little blue pull tab of what to pump up to. This number is 200. Now, what did I just do? I put a slight amount of pressure in to cause this outflow of blood going back to the heart to slow down. Everybody look at my hand one time. It's not cut off. It's just slowed down. Why would you want to slow down blood flow should be everybody's question. Blood flow going in and out of the muscle is what's carrying the oxygen, which is the primary fuel. So when you move, you're using oxygen. Now, why would you want to slow down blood flow and hence slow down oxygen? Well, you know the difference between going for a walk, which is using oxygen kind of slow, and running up and down the stadium stairs. If you run up and down the stadium stairs, you're using oxygen much faster. And you start to feel the burn or the lactic acid. That is a good thing. Matter of fact, it's probably the most powerful thing you can do to your body is create fatigue or drop in oxygen in the working muscles. Not dropping oxygen here at the heart or at the brain. That doesn't do this. In the working muscle, because that causes you to adapt. One of those big things is create growth hormone. So again, what we're doing is blood flow restriction, slowing it down. So now the muscle has less oxygen. So if we look at my hands, it's called oxygen flow at 10. You know that if you walk or do something light and use oxygen at a rate, say, of a 6, you're not going to really change much. But you know, if you lift heavy weights or do vigorous hard exercise or run up the steps, you're going to be using oxygen at an 11. 11 is more than a 10. You're going to use more oxygen than is available, and you're going to start to produce lactic acid. What do the bands do? Instead of exercising at an 11, why don't we just cut the oxygen in half? Now we don't have to exercise at an 11. We only have to exercise at a 6. Walking will feel like running. Lifting light weights will feel like heavy weights, yet it's super easy on your body. And then you get the fatigue or lactic acid that comes with heavy work. So can you imagine going for a walk? You're going to get the benefits of running. Lifting light weights like tubing or even water bottles, get the benefits of heavy weightlifting. Doing exercises or playing pickleball or hitting golf balls or running or biking or swimming, these are waterproof. Doing an exercise like that at low intensity, but your body responds as if it's high intensity. That would be the greatest biohack, in the history of human performance. Well, that's what we found. Yeah. So now You know, with all these people across the country, here's what they figured out. One, I can do it in less time,
Love that.
dramatically less time. I can do less load, volume, and weight on my body. So it's easier on my body. I can recover faster, and you actually get better results. You get more of this hormonal cascade that turns on, which we'll talk more about. So it's just this new way to exercise, and it's completely reshaping, you know, how we look at exercise. And I know, Dr. Lisa, you've seen it in your clinic, right? It's changing how you approach exercise and rehab.
Yeah, I mean, we were just talking before we started the podcast, about like compliance, like so many patients. I mean, everybody is so busy, nowadays that it's always hard for people to find, how do I get my exercise in? And now I'm like, hey, like while you do your rehab exercises, you can just put the bands on. And so now you're not only doing your rehab, you're, improving how, your pain levels, but now we're also pumping in, the growth hormone. We're helping to strengthen your muscles. And it's all within that 20-minute period. It just seems so much more manageable and people are more willing to do it. So yeah, so I've loved, not only for myself, but for my patients for sure.
Yes.
Yeah. So let's talk a little bit then about, you mentioned growth hormone. So why is this growth hormone so important? I know as we age, that growth hormone does decline. So talk a little bit about, what happens in our body as we're aging and that hormone's going down, and why it's so important, and how the bands really supercharge that release.
Sure. Well, let's talk two things. Nitric oxide, everybody's hearing about it, beets, beet powder, lozenges, and then growth hormone. When you do aerobic exercise like cardio or biking or walking, which is with oxygen, if you do it vigorous enough, you get a release of nitric oxide. Some people call it the runner's high. Other people call it the buzz. It's that release of this neuropeptide that increases blood flow everywhere and superoxygenates the body. And nitric oxide is one of the most powerful anti-aging substances in your body. Here's the challenge. You've got it in your arteries your whole life, but the only way it's going to come out is if you do vigorous exercise.
Yes.
So we have a huge part of the population, probably 97, 98% of people who are not experiencing any nitric oxide. So I want you to imagine if you could get that and you had more energy, better blood flow, more oxygen to all your tissues, anti-aging, antiviral, it's the second most powerful substance in your body. That's going to elevate when you do the band. So people constantly say, my joints are not hurting, or that I've quit hurting. I'm sleeping better. I've got more energy. I feel 20 years younger. This is a substance that's already in your body. Next, growth hormone. Everybody knows what that is, but here's what people probably don't know. You're not going to get growth hormone by going for a walk. You're going to get a little bit, maybe with some intermittent fasting, but not a surge. We're talking a little bit. You can take some natural stuff and get a little increase at night, and those are all good things. But you have this growth hormone surge system in your body, and it comes from doing strength training. Or let's break it down to make it real simple. You have to feel the burn and create lactic acid. That is working a different part of the muscle, and that's what triggers growth hormone. So here's two things people commonly do. They exercise and they don't get any burn, or they exercise and they get to the burn and they go, woohoo, there's the burn, I'm done. Well, here's the problem. The burn is where it starts.
Yeah.
It's not where it ends. So most people can't get to the burn and they can't stay in it because it's really hard work. But look, if you could stay in it, you'd look like one of those fitness models, right? Who's got all the growth hormone. You'd heal twice as fast. Your skin, hair, and nails would be young. Your wrinkles would be diminished. Your whole body would be 20 years younger. That's what growth hormone does. People spend $3,000 to $5,000 a month to inject themselves with it. But you have it sitting right here.
Yes.
Here's probably the number one thing I could teach your audience. You have growth hormone sitting right here. Yes, it's slowed down in your 30s, 40s, and 50s. Your natural release is slowed down. But you can get a big surge from exercise at any age. It's just sitting here at 20, 50, and 80. Just ready for you to go do some vigorous exercise that produces lactic acid. But guess what? You got to produce lactic acid for about 2 or 3 minutes. You can't just go feel it. You got to produce it continuous. So you got to run sprints or climb a mountain or lift heavy weights or go to a CrossFit class, and you got to go high intensity.
Yep.
Well, guess what? The bands, as we just learned, make that easy. Now, once you start using the bands and you get this light lactic acid burn, and every one of the listeners is going to be able to do this, doesn't matter your exercise level. After exercise, you're going to get this big surge of growth hormone. And again, people are spending $3,000 to $5,000 a month to get the synthetic stuff. You're going to get it naturally. So imagine a doctor could take out your own growth hormone out of your pituitary, replicate it, put it in a lab, bring it back, and give it to you in an injection you could take every day. People probably spend $20,000, $50,000, $100,000 a year for that, and you can get it very simply if you do the right exercise. And what's going to happen? You're going to build muscle. You're going to lose fat. This is something you rarely ever hear. I put on muscle and I burn fat. I mean, yes. You just don't hear, right? You lose fat, you lose muscle, right? And Lisa, you can tell them your story in 3 weeks. Yes. Yeah. But bottom line is this: you're going to be able to access your own growth hormone, and it is the most powerful substance there is. There's no medical procedure, no supplement, no gadget, and I've got them all. I love the gadget industry. I've got all kinds of cool stuff. There's nothing that compares to what was put in your own pituitary, your natural growth hormone. You're going to be able to access it and access big amounts of it.
Yeah, I mean, anytime you can stimulate what's already in your body is definitely ideal. So yeah, we were sharing, we just got an InBody, which is a body composition machine. And I tried it out, when we first got it. And then 3 weeks later, I made sure I was doing my BFR bands and I was increasing my protein. And in 3 weeks, I increased my muscle by 1 pound, which is a lot. The scale actually went up. And for those of you listening, thinking like, oh, you're trying to lose weight. No, we want to build muscle. And what a lot of times people do is they deprive themselves of calories and they see the scale number go down, but they are losing muscle. And muscle is so critical for our healthy, living and, to prevent falls and just to stay strong, and fit throughout, your years as you're aging. It's so important. And I see so many people too much worried about the scale going down. So my scale went up, but I had gained a pound of muscle and lost, 1.6% body fat. So I was like, okay, this is working. So I'm, before I bring anything into the clinic, I always love to test it out. So I've been testing it out. And there was another thing I forgot to share with you about my thyroid levels, which leads me into the next question. So I want to talk about, I heard one of your talks about, it was about the thyroid and about how doing the B3 bands and boosting, your growth hormone can actually improve other health situations, like improving blood sugar levels, improving the function of your thyroid. So I went for my physical and my thyroid is better. So they are decreasing my thyroid medication. And the only thing I really changed was using the B3 bands. So that was another thing. So talk a little bit about how, I know it helps our brain function. It helps our overall health and well-being, in addition to what people think about exercise and being, either trying to lose weight, gain muscle, or being fit. But how about our overall health?
Yeah. Well, growth hormone is called the master hormone. That means it goes downstream and it triggers a cascade of very beneficial other hormones and peptides. Let's start with the thyroid. When you get a exercise-induced release of growth hormone, you also get a release of thyroid stimulating hormone. Pay attention to the second word, thyroid stimulating hormone. It goes right here. Turns on your thyroid. Most ladies who have hypothyroidism get thrown into this Hashimoto's, which is a shame, because for most ladies, hypothyroidism is not a disease. Now, I'm not downplaying. I'm just saying you're not stuck. If you have hypothyroidism, unfortunately, you earned it. You didn't get struck down with some disease. You're just not exercising the body the way it's designed. So if you can get a vigorous workout and release thyroid stimulating hormone, it says, hey, thyroid, make some more thyroid hormone. And it does this for about 36 hours. So why is this beneficial? Well, what does the American Thyroid Association say right on their website? Every hypothyroid patient should do vigorous exercise. So we already know this. So the bands are going to allow you to go get that vigorous exercise that turns on the thyroid. And I've had so many women say, my thyroid's functioning better, or I'm off my medication. Now, I'm not saying do that, work with your doctor, but I'm saying we have just seen all kinds of thyroid turn on. Next, growth hormone goes down to your liver and releases IGF-1, which crosses the blood-brain barrier and fertilizes your brain. You've got a fertilizer up in your brain called brain-derived neurotrophic factor. It's just sitting right here, ready to protect your brain, keep it from degenerating, and improve function and cognition. Well, it makes sense, right, that if we're going to do vigorous exercise, our brain would benefit. Well, this is how it works. But again, if you do light exercise, you don't feel the burn, you think you're going to get on the treadmill at Planet Fitness for 30 minutes, you're not going to get any growth hormone from that exercise, right? And interesting, how many people ever say, yeah, I joined the local, fitness center. I get on the treadmill for 30 minutes. I listen to my favorite playlist and I build muscle. I'm losing fat, got my six pack, and I'm 20 years younger. Nobody ever, because it doesn't work. That's movement. Okay, so the next thing that happens is out of the liver, ladies, especially, you get bone-specific alkaline phosphatase, which is a secondary cascade from growth hormone. Guess what that does, ladies? It strengthens your bones.
Yep.
And yes, you can use heavy weights to strengthen your bones, but you can also do BFR and do the same thing.
Right.
You don't have to mechanically load bones to cause them to get stronger. What you have to do is produce lactic acid. You got to work your body. So you can do it with heavy weights, or you can do it with BFR. We've got all the studies. Next thing that happens is the cardiovascular system starts getting younger. Studies show that after one BFR session, your body immediately starts breaking down atherosclerosis. It starts reversing hardening the arteries, and it starts lowering blood pressure. Wow. It also improves your blood sugar metabolism system. But everybody knows this. If you would start doing vigorous short bouts, 15, 20 minutes of exercise, bands or not, your blood sugar is going to improve. Well, again, most people can't do that high intensity exercise. So we're talking immune system gets better, your bones, your tendons, your ligaments, your brain, your cardiovascular system, your organs, everything benefits from this growth hormone cascade. It's basically anti-aging in the neighborhood of 10, 15, 20 years. Lisa, I'll ask you, I usually ask everybody, how much younger do you feel now that you've been using the bands?
Oh yeah. Definitely years younger. I'm exercising, and I could feel how much stronger that I'm getting, because even, I was told, I think last year, the year before, that I was beginning to get osteopenia. So I've been doing a program called OsteoStrong, where you do an isometric right contraction, and it gives you a readout. Well, last week, I think it was last week or the week before, I hit like the highest numbers that I've hit, out of, the whole year that I've been doing it. So I could definitely tell I feel stronger and better, and, you mentioned, it's hard to exercise. Like, I have arthritis in my hand. You talk about being a chiropractor and how, it kind of beats up your body, right? We do a lot of manual work, and it was hard to lift heavy weights, right? Heavy enough weights, because I had pain in my hand. So I love that I can use the bands, and use lighter weight and not, have that pain in my hand, and really be able to get the results that I'm getting. So yeah, I love that.
Yeah. And by the way, all these things that we've talked about are all backed by studies. So, this isn't my opinion. What I've seen over 30,000 people with these results, but there's all these scientific studies, a lot of it out of Japan, that backs up what we're seeing. So this is all already grounded in science. If it wasn't, you wouldn't see every NFL team doing this. You wouldn't see professional basketball teams. Just had another NBA team bought 3 sets from us. Why would an NBA team? Because their guys can maintain muscle and work out
Yeah.
between games or in season with dramatically less work. So they recover faster.
Yes.
They have more, they're recovering better, but maintaining muscle. Why would NFL training rooms be doing it? Because they can bring injuries back faster by getting the exact same thing we're talking about. Better fatigue, more response out of the body with less work.
Yeah, and less stress to the joints, which is huge, especially for our athletes and our high level athletes that are just, hitting, either, competing at a very high level. And, when you're in season, you don't want to be loading the body like that, right? That's just a recipe for injury. And, both of us have seen that working with high level athletes. So I have one more question for you that I get all the time. When we talk about blood flow restriction, patients' eyes kind of glaze over and they're like, what, you're cutting off my blood flow? So talk about the safety, because especially the way that I love how easy your bands are. They are so simple. And the safety, how you have, exactly like written exactly, the instructions are great. So just talk a little bit about the safety of it, because that is something I hear from my patients, and I'd love, you to speak on that.
Right. Well, let's just go right to what people think is the worst case scenario. Let me give you a couple examples. Carpal tunnel syndrome, very common surgery that we do. So people of all ages go to the hospital, they put a tourniquet on the arm, and they cut the blood flow completely off. And they do surgery for 30, 45 minutes, and they sew you up. An hour later, you wake up and you go home. Is anybody dying? No. So this cutting off or manipulation of blood flow is not unsafe. Number two, we're not cutting off blood flow. Look at this right here. At rest, we have 5 liters of blood moving per minute. When I put the band on, that's reduced down to about 2. It's still moving. When I exercise without the band, I'm getting up to around 15 or 20. Blood's moving really fast. With the band, I'm probably down around 10. At rest, I have 5 liters of blood per minute. With the band on, I've got 10. I have more blood flowing during exercise with the band on than I do at rest. We're not cutting anything off. It's just not as much. Remember, it's just a slower flow rate. Okay, so you're not going to put the band on, pump it up as high as you can, and then go lay down and go to sleep. That would be silly. Nobody's doing that, right? Okay. Next, there's all kinds of safety studies. We've done safety studies in the University of Texas, and not only does blood flow not get cut off the artery coming in, our bands, when studied, did not even increase arterial pressure. That means it's not squeezing deep enough to even put enough pressure on the artery to increase blood pressure. Back at the heart, we measured oxygen demand. Is the heart able to supply itself? Because if it can't, you might get a heart attack. There was no increased oxygen demand. So back at the heart doesn't even know the band's here. And you're creating lactic acid. It's just doing the same function it always does. So it is inherently safe. And finally, this isn't a new technology. Look, they wouldn't be doing it on all the pro athletes and celebrities. And then finally, I mean, if I get people say, oh, they get really scared, I said, okay, go type in BFR, blood flow restriction, and death into Google. Because if it happened, it's on Google, right? Hasn't even happened.
Right.
So this safe manipulation is actually less stress on the body. You're doing less work, less load, and you recover faster. So it's actually safer than traditional vigorous exercise. Now, look, if your doctor says they don't want you exercising, that's different. If you have lymphedema, you've got severe swelling in your arms, okay, that's different. There are a couple basic contraindications, but I can tell you in my 6-7 years, we've probably only had 1 or 2 people we couldn't get bands on either the arms or the legs. So it's a very safe technology. And when you understand what it does, everyone, I mean, let me answer this question this way, and I'll go back to you, Lisa. People say to me, okay, Mike, yeah, it's cool technology. So tell me, smart guy, when don't you use the bands, right? Give me an idea. And I go, well, why would I want to do that? And I talk to some of the smartest guys in the world. Yeah. And I say, I'm not an Olympic athlete. I'm not a bodybuilder, and I'm not an NFL lineman. Tell me why I need to load my body with heavy weight. And they can't. And I say, well, why would I want to do more and spend more time and have more soreness and have more pain and get less growth hormone? I wouldn't. So for me, general person who just wants to stay in shape, there's not a single reason why I would work out with the bands unless I just like pounding my body for an hour in the gym.
I know. I think it's a mentality.
Yeah.
You know, it's just people think the only way I can get results is I've got to go out and I've got to, run marathons. I've got to lift heavy weights. I got to spend all this time in the gym. And I mean, honestly, even I was thinking that until I started really understanding the technology and using it. I was like, wait, I don't have to go 20 minutes. That's it. I'm like, set your clock, turn around, and you're done. 20 minutes, that's it. And so I really think it's a mentality thing. It's a shift in your perspective of what we've been taught, and like you said, all the the science, and it says we should be doing vigorous exercise for what, an hour, up to what, 6 times a week or something like that, right? So that's what's out there. That's what people think they have to do until they understand this technology.
Yeah, my workouts are, and I'll bring up one more topic that I'll teach everybody. The majority of people exercising in their middle ages are training too long, and people start hearing about cortisol. Overtraining is a big problem. It blocks results. You actually start burning up muscle and holding on to fat and burning out your adrenal and burning out your thyroid. My workouts max are 12 to 14 minutes. 3 to 4 minutes, I go in the gym, I do the elliptical, and then I do 4 to 6 minutes of strength training. I pick about 3 muscles, light weights. Then I do about 2 to 3 minutes of stomach, and I'm done. I'm walking in, and when I'm walking out, the same people are still on the treadmill and the stair climber, and I'm done, and I got that nitric oxide buzz. So it's such a paradigm change. And then once you experience it, to feel like rejuvenated when you leave the gym instead of beat up, to get out of bed the next day and feel loose and ready to go versus sore and tired. It's just a completely different, experience. And once you use them, it's like we say, Lisa, right? Once you use them, you tend not to go back to the old way.
It's so true. And I'm so glad you brought that up about cortisol levels, because so many athletes and just regular people that exercise overtrain. They do too much, like you said, and they wear themselves down. They elevate the cortisol levels, and now you're having the reverse effect. So you're like, I'm doing all this exercise, but I'm not losing any weight, right? Or I'm losing muscle. Like, what's going on here? So so I'm glad that you brought that up. So so now what I would like to do is just shift to, between your experience as a clinician and your experience with the bands. What would you say, if you can give us 3 tips on how to get better clinical outcomes? What would you recommend?
Number 1, for the clinician, use the bands on a non-injured body part shortly after surgery or injury. Once the acute phase is over, the swelling, if you can get a BFR band on the upper body when you're dealing with a lower extremity injury, you're going to elevate growth hormone and nitric oxide. You're going to double healing. Now this is aggressive, but my second hip replacement, I had the bands. 2 hours after I woke up and I was in my bed, I scooted over to the edge of the bed and I started doing BFR on my arms. Why would he do something crazy like that? Because I'm elevating growth hormone and nitric oxide. And then, as soon as possible, when you can do any muscle contraction, I'm talking about even just this or quadricep pumps, and you're starting the rehab process, get the band on. Instead of just doing movement, you're going to get a fatigue in the muscle. So I'm home on day 2, and I'm starting my hip rehab and not doing anything different, by the way, just putting the bands on, and I got the rubber band around the legs. And I got a pump on my muscles, and I just started walking because the muscles were all pumped up. So immediately try and implement it in your normal rehab protocol. And then number 3, continue to work the entire body. And here's what you're seeing across the board for all the clinicians: 30 to 50% improvement in outcomes across the board. Any study you read, knee, hip, joint replacement, tendon repairs, cartilage, fusions, fractures, plates. We had a lady who fractured her wrist and they had to put plates and everything in there, and they told her 12 to 16 weeks. She came back at 6 weeks and they're like, well, you're healed. That's elevated growth hormone. And as a clinician, think, okay, I'm dealing with somebody who's injured or has a surgical repair. Their growth hormone has already been crashed a little bit. You elevate that, you're going to cause just a profound change in your outcomes just by doing that. And there's one other thing, if we got any clinicians listening. Doing a BFR session, light session, before any of your manual therapies will produce dramatic results. Dry needling, Graston, myofascial release technique, EMF, any of the things you do with these wonderful skills you have. If you do a little BFR, I'm only talking about a minute, get a little pump and burn in the muscle. That muscle is going to be full of nitric oxide blood. It's going to respond dramatically faster to your manual techniques. A guy that taught me this is Rick Burkholder. He's the top, probably the most respected athletic trainer in the NFL. He started doing this on all his pro athletes. BFR on the bike or something to warm up, and then he'd do his dry needling. He said, I'm healing chronic tendonitis in 3 visits. It used to be chronic because I'm able to get nitric oxide going with my manual therapy.
Wow, that's awesome. I didn't realize that. I'm definitely going to try that. That's fantastic. Excellent. So, well, this has been so informative. Is there anything else that you would like to share with our listeners?
Well, number one, thank Dr. Lisa for bringing you this information. Try it. She's going to get you the information. Try it. You get a 30-day money-back guarantee. If you're working with her, she's going to give you protocols. If you're not directly in her clinic, we provide free coaching. So we're going to show you how to use the bands. I can tell you, you're going to love them. It's going to be one of the best investments you're ever going to make. You can travel with them. You can do them at the beach. You can do them at work. You can take them in your suitcase. You can take them to the gym, take them to imagine going to your kid's practice and you're sitting there for 2 hours and putting the bands on and walking around for 10 or 15 minutes and getting an incredible workout and elevating your growth hormones. So you can go shopping, push your shopping cart and put the bands on. So I would encourage all listeners to give these a try. That you're gonna love the response, and make sure to thank Dr. Lisa for bringing you this information.
Well, I would like to thank you for creating B3 Sciences and for bringing this technology to the forefront and making it so easy for clinicians, to share it with their patients, use it in rehab. So I appreciate that. I also appreciate, you always being so accessible and all the education and the videos that you've provided to all of us. It is very, very appreciated. So thanks for joining us today. And, until next time, keep getting great outcomes.
Thank you. Great to be here.